Text neck or tech neck. What is it? You should have a nice, perfect, kind of like a banana shaped curve in your neck, and that should go forward. What happens and what we're seeing on almost every x-ray these days, especially in our kids, is that we're losing that curve. And so that curve isn't just to look really good on an x-ray and for me to point out to you. That curve, the purpose of it is to act as a shock absorber for your neck. When you do that, you can move fluidly, you can do the things you need. Those nerves are happy and healthy. Those discs are working like they should, and they're not degenerating or causing arthritis. When you lose that curve and that neck goes straight, what happens is that the muscles around there are pulled tight or pulled taut, and you probably feel that. You might get lucky and somebody gives you a neck rub or a massage, but it's back the next day. That's because everything's being overworked and really overused. And so text neck, the nerves that come out of your neck and those muscles, they cause a lot of headaches. We see a ton of migraines. We even see some like thyroid issues, numbness, tingling in the arms, and the biggest one everybody complains about is tightness, that wearing out feeling in your traps, your upper shoulders, just a lot of fatigue, wear and tear. And so what causes tech neck is pretty much one of two things. One, a big accident or an injury at some point previously in your life. That could be something like birth, that could be car accidents, sports injuries. The second biggest reason for tech neck is technology, hence the name tech neck, and it's looking down at our phones, looking down at our watches, having a bad work computer set up and looking down all the time. And that chronic wear and tear causes you to lose that curve and to come forward. And so the best way to figure out if you have tech neck is through an x-ray. And so we take x-rays on every patient. We know for a fact if you have it, but then we also take a series of motion x-rays where we're able to see how are things bending and moving and figuring out which bones and which vertebrae are part of the problem, what's causing it, and then to be able to correlate that with your findings. There's a ton of info coming out about tech neck this month from us, and so if you're looking for that, make sure to follow us, like this video, subscribe, and learn more, because tech neck could be affecting you, your loved ones, and if it's not, it could be in the future. So I've been Dr. Nick. You've been awesome.